Hello, this is Dr. Taylor, and today we're going to talk about inflammation in breast cancer. Is it the seed or is it the soil? Breast cancer incidence and death. As we all know, breast cancer is the second leading cause of death in women ages 20 to 59. It is estimated that 1 in every 8 women will be diagnosed with breast cancer. In the United States, a breast cancer diagnosis occurs every 3 minutes. Everyone either knows someone or has been indirectly or directly affected by someone with breast cancer. My sister just passed away in October of last year due to breast cancer. So this has gotten to be even more important to me. And I've done this lecture for a while, and my sister's case is definitely a case where you can see that inflammation in breast cancer has some connection. So we cannot solve our problems with the same thinking we used when we created them. So this is breast cancer is a big problem, and we have been thinking about it in one way for a long time. But Louis Pasteur, back in 1895, he made the statement that the cell is nothing and the matrix is everything. And in 2009, a New York Times article reported, "Old ideas spur new approaches in the cancer fight. The new focus on a cancer surrounding researchers says it's a major shift in thinking about why cancer occurs and how to stop it." For years, we have been focused on the genetic cause of cancer with the discovery of BRCA1 and BRCA2. This has been how we have been thinking about the war on cancer. When we're talking about the genetic part of cancer, this is very interesting, and this was reported in 2003 in Science, is that if you have the BRCA1 and the BRCA2 mutation, the lifetime risk of actually developing the cancer is 82%. Now, in 1940, it was only 24%. So it is likely that physical exercise, obesity, and adolescence may be important modulating factors. So this is stating that there's more involved than just the genetic mutation alone. The environment, the habits of the person, affects the expression of this gene, and something has changed drastically from 1940 to at that time 2003 to make the lifetime risk almost quadruple in that time. The prevailing paradigm for years has been the somatic mutation theory. It says that early stage carcinogenesis is the somatic mutation theory, which states that cancer results from an accumulation of mutations and other heritable changes in susceptible cells. So it's thought that cancer arises from mutations in the genetic sequencing of genes. Now, another theory is the tissue organizational field theory, that cancer arises from the disruption of tissue microarchitecture, or the extracellular matrix, driven by the collapse of the morphostat gradients that maintain that integrity. So the tissue around the cell actually determines what that cell is exposed to. It determines what gets in, and it also determines how quickly things are excreted from the cell and removed from that environment. Now, the problem with when you're changing a paradigm, when you've been thinking about something one way for so long, it's very hard to shift gears. So when you are thinking about it as a genetic problem, it's very hard to change gears and to change the paradigm. It's almost like treasure hunting. If you have a map for a treasure and it has map A and then map B, the longer you follow map A, the closer you think you are to getting to the treasure, and the harder it is to switch gears and to go and try and follow the course of map B. It's like waiting for a bus. The longer you wait for the bus, the more likely you are to think that that bus is just about to come, and it's not likely that you are going to go to another stop because you're worried that if you leave that the bus is going to come. So that's kind of how it is with cancer. We have been in this fight against cancer since President Nixon was in office, and we keep thinking that we're closer and closer and closer to it. And it's hard to change paradigms and start to think about the environment of the cancer and not just the genetic sequencing of the cells. So when you read this last section, it says theories of early stage carcinogenesis. The more resources expended to try to uncover the exact nature of somatic mutation theory, the more you think that you are nearing a breakthrough in understanding somatic mutation theory, and the more you think that a competing theory, such as tissue organizational field theory, is correct, especially in light of observations that are paradoxical under somatic mutation theory. Again, we have been following the somatic mutation theory since President Nixon declared a war on cancer. And this was a long time ago, and we've been following, but we keep raising money, devoting resources toward this theory, and we keep thinking that we're closer and closer and closer. And maybe we are actually following the wrong roadmap. And so it's at least worth looking at another theory to see if we should devote some time and resources and thought toward this other theory. Ivan Pavlov, who lived in the 1800s, said, if you want new ideas, read old books. If you want old ideas, read new books. So when we're looking at breast cancer and inflammation, actually we need to look at some old ideas. And in 2009, the New York Times reported old ideas spur new approaches in cancer fight. Mina Bissell will never forget the reception she got from a prominent scientist visiting Lawrence Berkeley National Laboratory where she worked. She gave him a paper she had just published on the genesis of cancer. He took the paper and held it over the wastebasket and said, "What do you want me to do with this?" And then he dropped it in the wastebasket. Well, the matrix theory means that cancers grow in part because normal cells surrounding the cancer cells allowed them to escape. It also means that there might be a new way to think about treatment. Cancer might be kept under control by preventing healthy cells around it from crumbling. So instead of worrying about the genetic makeup of the cancer cell, we should be more concerned with the healthy cells and making sure there's healthy cells around the cancer cell. Also in this New York Times article, Dr. Vogelstein said, "I am an unabashed cancer geneticist, director of the Ludwig Center for Cancer Genetics and Therapeutics at Johns Hopkins," which is where Dr. Vogelstein is. "The genetic alterations in the cancer cells are the proximate cause of the malignancy." But Dr. Vogelstein said, "One cannot fully understand that disease unless one understands the tumor's environment." So cancer cells, the basic idea, or this old idea, is cancer cells cannot turn into a lethal tumor without the cooperation of other nearby cells. Autopsies show dormant clusters of cancer cells. If you do autopsies on older men particularly, about 80 to 90% of them will have cancer cells in their prostate gland, but they won't have died of prostate cancer. The cells around the cancer encapsulate those cancer cells so that they don't spread. The decreased cancer incidence or prevent spread of cancer by maintaining a healthy matrix and not by killing cells. Because when you try to kill cancer cells, you're also going to kill healthy cells, and those healthy cells around that cancer are going to be weakened and inflamed, and that inflammation can be a pathway for those remaining cancer cells to spread. There's other experimental information about inflammation or tissue injury. Does injury promote cancer? Well, if you inject virus in one chicken wing, a cancer-causing virus, and wounded the other wing where you didn't inject the virus, the tumors are on both sides because the wound wounded other wing that you didn't inject the virus is the most vulnerable to the cancer virus. It's been shown that surgery and the inflammation that is caused out by the healing after surgery may promote tumor spread, and also inflammatory processes like hepatitis B and C seem to promote cancer. Now, this is looking at the decrease in breast cancer after the Women's Health Initiative. And the Women's Health Initiative came out in July of 2001. And after that, they saw a significant decrease in breast cancer. Now, what was strange is that breast cancers take 6 to 7 years to manifest themselves. How is it that breast cancer incidence went down so quickly after the Women's Health Initiative and several people were taken off Premarin and Provera? Well, in that article, what they saw is that discovery began with a surprise, that the rates of breast cancer in women 50 and older suddenly fell 15% after the rates for all women had steadily risen since 1945. The pattern held even in 2004, 3 years later. The drop was traced to the release of a large 2002 that reported that Prempro, or hormone therapy for menopause disease, actually made heart disease more likely and slightly increased the risk of breast cancer. Because sales plunged as millions of women stopped taking the drug, but cancer is supposed to take years, even decades, to develop. How, some ask, could cancer rates drop so quickly? Could it be possible that hormone treatment somehow changed the environment of naturally occurring cancer cells and let them progress? So Dr. BUQgbKx6SNSZZjKDa43s Professor of Medicine, Epidemiology, and Biostatistics at the UCSF, now believes that is the possibility. A combination of estrogen and progestins, like that in Prempro, may change the structure of activity of breast tissue. She found that making breast tissue denser, a condition that has nothing to do with how breasts look or feel. Breast density is a cellular structure seen on mammograms that has long been associated with higher cancer risk. Well, it is believed that it is the matrix because DCIS cells are no different than cancer cells, but they are confined. They don't spread. They don't go through that bottom layer and allow metastasis. Wound healing after surgery can destroy the matrix, and so this tissue is, now that it's damaged, it's more likely to allow a cancer cell to move through that matrix. And progestins, which I think everybody knows now, is that the progestins were probably the real instigator of cancer when we were talking about combined estrogen and progesterone therapy. We're really talking about Prempro. We're not talking about real estrogen and real progesterone. We're talking about Premarin and Provera. But progestins definitely increase a substance called matrix metalloproteinase, which that's its job, is to disrupt the tissue matrix. It destroys the matrix around cells. So that combination of Premarin and Provera, that was the combination that really significantly increased breast cancer. So it's definitely a part, that matrix is very important when we're talking about breast cancer and especially the spread of breast cancer. So the extracellular matrix. Now, the breast cell matrix is a nurturing glue-like substance surrounding every breast cell. The matrix system controls the metabolism and biologic activity of the cell, as well as waste removal. So you have to see that, hey, it controls what goes into the cell, and it controls how quickly toxins are removed away from the cell. It defends the body against infection. It holds body fluids. It stores nutrients, supports and binds tissue together. A healthy matrix confines the cells and prevents them from dividing abnormally. This is a great book I think everybody should read, Anti-Cancer, A New Way of Life. This is Dr. Schreiber. He was someone who had a brain cancer, and he went through all of the regular treatment, the chemotherapy, the radiation therapy, and he was told that There was nothing else for them to do. He got very interested in Eastern medicine. He cleaned up the way he ate. He decreased the stress in his life. He did all of these things to try and make himself as healthy as possible. Well, he lived another 20 to 25 years. And he wrote this book, Anti-Cancer, A New Way of Life. It is a great, great book. Any patient that I have that has cancer, I recommend it to them. I recommended it to my sister when she found out she had breast cancer. And to give you a little bit more history on my sister, about 5 years before she had the breast cancer diagnosis, she was diagnosed with polymyositis, which is inflammation of muscles. She had gotten to the point where she couldn't hardly get up out of a chair. So she had a polymyositis. So she had multiple areas that were inflamed. And she was treated with that with steroids. She gained the weight. She had all the problems with steroids. And about 4 or 5 years later, she was diagnosed with breast cancer that was estrogen and progesterone negative, which is probably the worst cancer you can have. And she had been inflamed for 5 years. So I knew this was not a good combination for her. I didn't necessarily say that, but I tried to imply that, but I knew that was not a good combination. And the cancer was very hard to treat, and it really didn't respond to anything. And she finally passed away in October. So that is a personal experience of inflammation and breast cancer. But anyway, we go back to this book, Anti-Cancer, A New Way of Life. It became very popular. He began, one of the major tenets in this book is to decrease stress, because stress is inflammatory. Well, this book, after he wrote this book, he became very popular. He's, as you can see, he's a physician and a PhD. And he started traveling, promoting his book and talks. He became very popular speaker. And the cancer returned. And he wrote another book saying how he stopped taking his advice. He was stressed out with traveling, and the cancer returned, and he actually recently passed away. So these are two life experiences that we can see that stress, inflammatory either diseases or inflammatory actions, like stress, not eating well, can promote cancer. So I really encourage you to read this book. Breast inflammation is the key to cancer growth. Again, I had read all of this, and I knew the combination in my sister was not good. It took 12 years and the creation of a highly sophisticated transgenic mouse, but researchers at BUQgbKx6SNSZZjKDa43s Institute have finally proven a long-suspected theory. Inflammation in the breast is key to the development and progression of breast cancer. Signaling pathways regulating aromatase, cyclooxygenase, which is an inflammatory prostaglandin. One of the ways it can promote breast cancer is that it increases aromatase activity. If you follow this, you can see that oncogenes and growth factors and tumor promoters all increase COX-2 gene expression. And it's been shown that NSAIDs will block COX-2, and we'll see in a few more slides that aspirins and NSAIDs have been shown to decrease the risk of breast cancer in postmenopausal women. Well, because COX-2 will increase inflammatory prostaglandins, and those inflammatory prostaglandins actually increase P450 aromatase, and that is going to aromatize androgens into estrogens within the tissue. So this is something that's not taking place in the blood. You're not going to see it there. It's happening in the tissue. And so it is actually a estrogen production factory that is going to increase proliferation in estrogen receptor sensitive and estrogen receptor positive breast cancers. So inflammation, increasing aromatase activity, is really an estrogen factory within the breast cancer cell and the matrix. And we know about the COX and LOX, where omega-6 oils will increase series 2 prostaglandins, which are more inflammatory, where omega-3 will increase series 3 prostaglandins, which are more favorable and less inflammatory. Inflammation damages, we're talking about inflammation, that aspirin intake and survival after breast cancer. In the Journal of Clinical Oncology said aspirin use could possibly increase survival among women with breast cancer. The role of COX-2 in epithelial stromal cell interactions and progression of ductal carcinoma in situ of the breast. So again, you decrease inflammation, you decrease aromatase activity, and you decrease estrogen receptor positive breast cancer proliferation. Again, this article in 2015. While aspirin use may not affect overall risk of breast cancer, but decrease risk of in situ breast tumors or hormone receptor positive tumors, and reduce risk of breast cancer in postmenopausal women. So this was just as recent as 2015. This is an article, characterization of COX-2 during tumorigenesis in human epithelial cancers. Evidence for potential clinical utility of COX-2 inhibitors in epithelial cancers. So if you decrease inflammation, will you decrease cancer progression? So this is the role of COX-2 epithelial stromal cell interactions and progression of ductal carcinoma. These findings support a role for COX-2 in promoting the progression of DCIS to invasive breast carcinomas, and suggest that therapeutic targeting of NFB and prostaglandin signaling pathways might be used for the treatment and prevention of breast cancer. COX-2 inhibitors, so there's several articles, and I'll have these for your review in the course, but I just want to show you that this is something that has had a lot of research. This is showing, this is actually a stain for COX-2 expression, and you see that there is a lot of expression in this invasive ductal carcinoma. So how can you look at this? A little COX-2 expression was associated with 2.6 times the risk. Moderate COX-2 expression increased risk by 3.5 times. Strong expression of COX-2 elevated risk by more than 5.6 times. So the more inflammation, the more expression of breast cancer you're going to have, or cancer you're going to have. How does COX-2 contribute to cancer? It inhibits apoptosis. It stimulates angiogenesis, so it stimulates bringing the blood supply into that cancer. It causes immunosuppression, and it enhances invasiveness. As we know, anything that's inflamed is kind of soft and mushy and leaky. So if it is inflamed, it is going to, that breakdown of the matrix increases the likelihood that a cancer cell can move from its location and metastasize to other areas. So the inflammatory process is very complicated. I'm just doing this to show you how complicated it is. It's many factors involved. And a lot of times when you target one part of this inflammatory process, the body is very smart, especially cancers are very smart, and they can go to another area in the inflammatory. So the contribution of COX-2, it's in several areas. It inhibits apoptosis, enhancement of angiogenesis, increased evasiveness, increasing cell growth, and producing mutagens. So breast cancer stabilization, how can you stabilize the cellular matrix to try and prevent this disruption and the increase in invasiveness of the cancer? Well, at the cellular levels, you can inhibit cancer initiation. You can decrease tissue inflammation by preventing promotion of preventing the promotion of new tumor formation. You can try and control angiogenesis and vasculogenesis. You can also have regression of tumor if possible, encapsulate and render the tumor dormant, preventing further growth and metastasis. This is what you would like to do, is to just kind of encapsulate it. That's what we see in DCIS. That's what we saw in cervical intraepithelial neoplasia, CIN 1, 2, and 3, is just keep it confined it's easier to either remove the cancer, and now in CIN, we know that in most cases it will regress on its own. If you can keep the tissue around it healthy, it will actually kind of choke off the cancer where it just is not able to progress. One of the discoveries that was found in 1992 was sulforaphane. There's over 1,500 articles. There's around 1,500 articles, and 3,100 total articles are now published. Sulforaphane is rich in broccoli sprouts and Brussels sprouts and kale. This is the most potent part of, we know about indole 3-carbinol and DIM that are in these vegetables like broccoli and Brussels sprouts. But sulforaphane seems to be the most potent transcription inducer of phase 2 detoxification and antioxidant enzymes. It increases all of these enzymes that we're showing here. And here are all of the articles. There's over 1,499 NIH grants. I think I may have done this. This was in 2016. There's probably more now, but these are all the articles talking about sulforaphane and its effect on all cancers, and also on the phase 2 detoxification. So sulforaphane is the most potent of the phytochemicals that are thought to be a part of phase 2 detoxification. So even when you look at curcumin and quercetin, which we are going to talk about, and lycopene, we're going to talk about later, you can see that sulforaphane is definitely the most potent. What does sulforaphane do? Well, it inhibits phase 1 enzymes, and if you remember in our lecture about hormone metabolism, is that phase 1 detoxification actually causes the production of a more potent toxin than the original toxin. So it's very important to inhibit phase 1 and to increase phase 2 detoxification. It decreases polymerization. It increases apoptosis. It inhibits inflammation. It has several points of action when it is involved in the prevention of tumor progression. Curcumin is another anti-inflammatory. It's the most abundant polyphenol present in dietary spice turmeric. Turmeric is a very hot supplement now. It resembles ubiquinols and other phenols known to possess strong antioxidant activities. It does require purpurine and intestinal flora to increase bioavailability. And purpurine is an extract from pepper. So turmeric must be combined with pepper or pepperine from the pepper in order to increase its absorption. Common doses are 400 to 600 milligrams. The content of curcumin and turmeric is about 4 to 5%. So curcumin is the active ingredient in the turmeric. So even when you look at curcumin and quercetin, which we are going to talk about, and lycopene, we're going to talk about later, you can see that sulforaphane is definitely the most potent. What does sulforaphane do? Well, it inhibits phase 1 enzymes, and if you remember in our lecture about hormone metabolism, is that phase 1 detoxification actually causes the production of a more potent toxin than the original toxin. So it's very important to inhibit phase 1 and to increase phase 2 detoxification. It decreases polymerization. It increases apoptosis. It inhibits inflammation. It has several points of action when it is involved in the prevention of tumor progression. Curcumin is another anti-inflammatory. It's the most abundant polyphenol present in dietary spice turmeric. Turmeric is a very hot supplement now. It resembles ubiquinols and other phenols known to possess strong antioxidant activities. It does require purpurine and intestinal fluid to increase bioavailability. And purpurine is an extract from pepper. So turmeric must be combined with pepper or pepperine from the pepper in order to increase its absorption. Common doses are 400 to 600 milligrams. The content of curcumin and turmeric is about 4 to 5%. So curcumin is the active ingredient in the turmeric. The effects of turmeric and curcuminoids is very vast. It affects almost every system in the body, from the cardiovascular system. You see it helps with atherosclerosis. It helps with ocular diseases and everything in between. So this is a very, it's almost essential that you use this, because inflammation is a part of so many chronic diseases and chronic processes or dysfunctions in the body. And so this is almost an all-encompassing anti-inflammatory, and that's more and more people are finding out about it, and more people are using turmeric. And as we were talking about the inflammatory process, I told you, when you only, like with COX-2 inhibitors, when you only look at one part of the inflammatory process, a lot of times the cancer will go to another part of the inflammatory process and involve that. And substances like curcumin and sulforaphane, because they have multiple effects, and that's what you find in a lot of natural supplements, it affects multiple areas and not just one area. And that's why you have to be careful not to break down a natural product too much, and you will eliminate some of its wide-ranging effects. So these more natural anti-inflammatory products, they cover a lot more areas than when we just focus on one part of the inflammatory process. Curcumin is not only inexpensive and atoxic and potent COX-2 and INOS inhibitor, it also is a potent inducer of heat shock proteins and a potential cytoprotector. And heat shock proteins are something that that should increase when the body is under any type of stress, and cancer is definitely a stress, and it protects us against stress. Curcumin does not only inhibit COX-2, it also inhibits lipoxygenases and leukotrienes such as LBT4 and 5-hydroxyeicosanoic, especially when bound to phosphatidylcholine micelles. Apigenin blocks induction of vascular endothelial growth factor, messenger RNA, and protein in progestin-treated human breast cancer cells. Vascular endothelial growth factor is very important in cancer because that cancer must recruit a blood supply in order to survive. Apigenin is a low molecular weight flavone found in fruits, vegetables, and nuts, and plant-derived beverages such as tea and wine. It is reported to reduce levels of vascular endothelial growth factor and block the proliferation of breast, colon, leukemia, skin, thyroid, ovarian, and prostate cancer cells. Apigenin also downregulates the expression of endogenous estrogen receptor in the mouse uterus. Several mechanisms have been proposed to explain the anti-carcinogenic effects of apigenin. These include suppression of inflammatory processes. So you see here, it blocks vascular. We just showed you that. In summary, we provide evidence that apigenin inhibits MPA-induced vascular endothelial growth factor at both the messenger RNA and protein secretion levels. It also produces progesterone receptor protein levels in these cells. Because progestin-dependent vascular endothelial growth induction is crucial for the mediation of angiogenesis by causing proliferation of endothelial cells and proliferation and survival of breast cancer cells, this study provides evidence that apigenin has great potential as naturally occurring chemoprotective or chemotherapeutic agent against progestin-dependent breast cancer in postmenopausal women. Capsaicin, as we know, is a spice. Also seems to have anti-inflammatory effects. This is also good for decreasing pain, but here it says, therefore, the use of capsaicin as a chemopreventive agent is of immense benefit for cancer chemoprevention. The search strategy included printed journals, PubMed and Medline using the term capsaicin and anti-cancer citations relevant to anti-cancer properties of capsaicin. These are tea catechins. This is found in green tea. Has also been shown to decrease cancer progression. These results suggest that many have begun to suspect that isolating a single compound from complex foods may not be effective cancer prevention even at high relatively toxic doses, whereas combinations of lower, less toxic doses of each compound might be effective. Clearly, e.g. CG or other polyphenol chemicals may require interreactivity or dependency upon other components in the whole food source. This idea is supported by the general clinical findings that individual dietary components have not been very successful in preventing cancer. And that's why I was saying earlier that you don't want to break down these natural occurring products too much, because the combination of these different cancer-preventing natural substances seem to work better than when you do them alone. And this is because these are articles about synergy. When you're dealing in more natural medicine, things work better together than they do separately. If you're talking about adaptogens like ginseng, rhodiola, cordyceps, they actually work better in combination than if you just give someone ashwagandha or cordyceps. And this seems to be how the body works, as I showed you in the inflammatory process. There's multiple areas in the inflammatory process. And if you just isolate one substance, it may only affect one area of that process. But if you have a more comprehensive natural product and you don't break it down excessively, then it is going to cover more areas. In Western medicine, we want to find the one magic bullet, but that does not necessarily hold true when you're talking about more functional type medicine. So these are all of the different things that have been found to stabilize the matrix. Essential oils, isothiocyanates like sulforaphane, diluted remedies, these means like homeopathic remedies, catechins that are found in tea, curcuminoids that we've talked about, and steel beans like resveratrol. So all of these have been shown to stabilize the matrix. So if you can't focus too much on one, you want to kind of have a variety of these available in order to attack this matrix stabilization at multiple areas. Breast cancer in younger women. About 19% of breast cancers occur in women 40 to 49, than in women 50 to 59, accounting for approximately 20% of all deaths from breast cancer. So the most deadly time to have breast cancer between 40 and 49. So if we have a prevention strategy of mammograms, this is the area, this is the age that we would want to target. Well, mammograms aren't that effective, according to Spiroff, because tumors grow faster in younger women, and accurate mammograms are more difficult due to dense breast tissue in younger women. So mammograms don't work that well. And then this is a report that came out, I don't have the year, but it was about 2 years ago. It said most women don't need mammograms in their 40s and should get one every 2 years starting at 50. A government task force said on this Monday. It is a major reversal that conflicts with the American Cancer Society long-standing position. And this is one of these get out of line moments, is that also the task force says breast self-exams do no good and women should not be taught to do them. Now that's very radical or very much against the dogma that I was taught when I went through my residency 20-something years ago. It's very hard to unlearn something, and this has not been unlearned. This came out, it caused a big stir, and then nobody talks about it anymore. For most of the past 2 decades, the Cancer Society has been recommending annual mammograms beginning at 40. But the government panel of doctors and scientists concluded that getting screened for breast cancer so early and so often leads to too many false alarms and unneeded biopsies without substantially improving women's odds of survival. And remember, those biopsies are damaging tissue. That if you have a small cancer there, now you've damaged the tissue around it. The benefits are less and the harms are greater when screening starts at 40. And this is from the chair of the panel. Now, this was met with incredible opposition by the American Cancer Society, by the radiologists, because when we're talking about the power of popular thinking, this is a dogma that has been around for 30, 40 years. It's very hard to get people to change. And even though the science demands that we should do something different, nothing has changed. This is, I think this was like 2 or 3 years ago, and the American Cancer Society, the American Association of Radiologists fought this tooth and nail, and absolutely nothing has changed. That's just, it's disheartening that when we get new information, we don't use it. If mammograms aren't a good way of looking at this, then what can we do? Well, inflammation produces heat, and you can thermographically measure the amount of damage incurred by the breast cell matrix. The ability to detect heat fluctuations permits the thermograms to act as a looking glass into the breast. It provides valuable information on the status of breast matrix 8 to 10 years before a tumor can be detected by mammography. So you can either wait and look at a mammogram that is going to be 8 years behind, and if you're age 40 to 49, it's really not going to show you anything. Or you can use thermography that is looking at the heat pattern. Changes in these patterns over time aid in defining the health of the breast matrix. Persistent abnormal thermograms carry a 20 times increased risk of developing breast cancer. So this is with thermograms, you don't have to squeeze the breast where that may injure tissue, and we know about how tissue injury could actually increase the risk of breast cancer. And that's why you don't want to do multiple mammograms on these patients who are 40 to 49, because you're damaging tissue every time you squeeze the breast with the mammogram equipment. So inflammation produces heat. You can look at the heat pattern, and you can tell if there's inflammation there, and whether there's a breast cancer there or not. You want to decrease that inflammation, because as I talked to you about my sister, when you have inflammation there, it is a fertile ground for the seed of that breast cancer to grow. This is a thermogram, and it's easy to see. You can see that there's more heat on one side than the other. I think this is actually a person who had breast cancer. In the other breast, you can see the scar there, and this is a recurrence. This is looking, a good friend of mine down in Texas. He has been doing this for a while, doing thermograms, and he actually developed a cream that has a lot of the ingredients that we talked about, the essential oils, the homeopathics, the sulforaphane, and he uses a topical cream to decrease inflammation. The initial thermogram is at the top, the follow-up 30 days later, and you can see how the heat in those areas has gone away. Well, we have thermograms available. Insurance doesn't cover it. Most people don't do it, even though the science clearly says it can look for breast cancers or see breast cancers as they're forming 7 to 8 years before they're ever noticed on a mammogram. This is the time where you can actually do something about it. You can use some of those natural remedies to decrease inflammation and actually encapsulate any cancer cell that may be there. But as I've said before, unfortunately, most people would rather live with old problems than new solutions. This is a statement from John Maxwell. And again, it's popular it's popular to do mammograms. It's not that popular to do thermograms. But the problem with popular thinking is that it doesn't require you to think at all. And I think that's what's happening at the American Cancer Society and the radiologists. They're doing what's popular. They're really not thinking about what is the goal. The goal is not to make sure you can identify cancers. The real goal is to try and find areas before they actually become cancers. Let's change the environment of that tissue so that that tissue is not susceptible to the spread of a developing cancer cell. It's easier to do what other people do and hope that they thought it out. And so what we need to do is think it out ourselves, not go by popular thinking, but do what the science and the research tells us. So I hope you enjoyed this. This was not supposed to be an in-depth type of lecture, but it is really to get you to just broaden your horizons. It's not all about hormones. It's about hormones. It's about inflammation. And the next part of this course will talk about another area, which is stress. We talked about stress and hormones, but we're going to really focus on stress and how that affects everything, and how do you identify and treat stress, because stress creates inflammation, and inflammation creates breast cancer. And so we just want to get you to broaden your horizons. I know this is about bioidentical hormone replacement certification, but it's important to expand your knowledge beyond hormones. So thanks for listening to this lecture. Thanks for signing up for the course, and we'll continue to present information, and we'll continue to learn together. All right. Thanks a lot.